Then when they use that syringe to go back into a multi-dose vial, they contaminate the vial.
Our top story at 5, a Santa Barbara doctor's office is back in the spotlight for all the wrong reasons. Tonight, the details in a newly released health report. Hi there, thanks for joining us. I'm Beth Farnsworth. This new report reveals why health officials shut down the doctor's office. Several patients came down with the potentially deadly disease. News Channel 3's Elise Martinez joins us live in studio. This report is very detailed and it's a long report.
It's a long report. It's 10 pages long, and it details what health officials saw during visits to Dr. Alan Tomaszewski's office in Santa Barbara. His office was shut down after the second visit in March, but was recently allowed to reopen after he made several corrections to his practice. But health officials never revealed the health violations made by Dr. Tomaszewski until now. For the first time, we're getting a look inside the practice of Dr. Alan Tomaszewski. It was here at least 5 patients who received injections were infected with hepatitis C. These photos come from the last visit by health officers over a 3-month period. On February 23rd, the health department came into the office as part of a hepatitis C investigation. They found several violations. Officials also observed the doctor reusing syringes.
There should be 1 syringe and 1 needle on 1 patient, and it should be changed every time.
The second visit on March 18th was unannounced.
There were a number of things that had been corrected, and that was the good news. Unfortunately, there were also a number of things that had not been corrected and additional items that we discovered during that unannounced inspection that were concerning enough to me as health officer to warrant the action of actually closing an office.
Tomaszewski did not wash his hands or wear gloves while injecting a patient in front of officials. Clean needles and syringes were mixed with dirty ones in work areas. Officials also realized a receptionist with no medical training was processing blood and fat, then dumping it into a sink.
And it became apparent during inspection number 2 that the receptionist had a very significant role in processing all of the specimens.
In those photos snapped on the 3rd visit, one showed Tomaszewski may have been living in the office. I called Dr. Tomaszewski's office again today. The answering machine states he's not seeing patients. I also emailed him but got no response. The health department says a completed investigation report is expected by December, and this report is on our website, and you can read it in its entirety at KEYT.com.
You know, we've been covering this story for the last months, and just curious if any more patients have been diagnosed positive.
Again, they're still collecting data from hundreds and hundreds of patients, and we should know if more people tested positive by December.
Okay, 1,400 patients, I believe, was the number. Okay, yeah. Thanks so much, Elise. Okay.